Introducing the world's first dual-chamber leadless pacemaker system, Aveir DR, featuring beat-to-beat synchrony on an upgradable system with long-term retrieval. In our worldwide clinical trial, the Aveir DR leadless pacemaker system was evaluated across 300 patients. The procedure was successful in 295 patients with a 98.3% dual-chamber procedural success rate and a mean AV synchrony of 95% or greater observed for multiple postures and gaits. Using two distinct devices, one designed for the right atrium, the other for the right ventricle, Aveir DR enables sensing and pacing in both the right atrium and right ventricle. Continuous atrioventricular synchrony, or beat-to-beat synchrony, is achieved by proprietary eye-to-eye or implant-to-implant conductive communication using the patient's bloodstream. Aveir DR can be tailored by implanting an atrial or ventricular device alone, or both devices combined for true dual-chamber pacing. The option to upgrade over time meets the patient's needs today and accommodates for disease progression tomorrow. The helical design facilitates long-term retrieval for the replacement of the atrial or ventricular device at end of service without leaving hardware behind. The Aveir DR's predicate device has a long-term retrieval success rate of above 88% through 9 years, regardless of implant duration. Unlike traditional pacemakers, Aveir DR uses no leads or wires. It is placed directly inside the heart, and no incision in the chest is made to hold the generator. The clinical benefits include no lead-related complications, no pocket-related complications, no chest scarring, and no arm movement restrictions post-implantation. The minimally invasive placement begins by gaining access with a specially designed catheter. The device is advanced into the right top chamber, which is known as the right atrium. Afterwards, it moves through the tricuspid valve into the bottom chamber, known as the right ventricle. Then the device is advanced until it contacts the heart tissue that will allow the physician to map prior to fixation, ensuring the optimal location. While mapping, the device can measure R waves, impedance, and an initial capture threshold before fixation by simply touching the leadless pacemaker's tip electrode to the endocardial tissue. Again, the purpose is to find the ideal location for the pacemaker. The device is then turned, which engages the helix into the soft tissue. The catheter is placed into tether mode to allow for final testing. When testing is satisfactory, the device is released. The catheter is removed, and a new delivery catheter and device are inserted to support the implant of the atrial device. The atrial device is smaller and has a double helix designed to better accommodate the specific characteristics of the right atrium. The atrial device is advanced to the right atrium, where mapping prior to fixation is performed again, ensuring the optimal location. Once the device is fixated, the catheter is placed into tether mode for final testing. It is then released. The two devices undergo eye-to-eye pairing, and implantation is complete. The dedicated retrieval catheter can be used to retrieve an implanted leadless pacemaker acutely or long-term. During a retrieval procedure, the retrieval catheter is advanced into the right ventricle, aiming for the LP docking button. Once positioned, the snare is closed around the docking button and locked into place using the snare control knob. The leadless pacemaker is then docked to the retrieval catheter and covered by the protective sleeve. The snare control handle is slowly turned counterclockwise to unscrew the leadless pacemaker until at least 3 full turns of the LP chevron are observed. The protective sleeve is then fully advanced to completely cover the LP helix, and the retrieval catheter is removed from the heart. As the world's first dual-chamber leadless pacemaker system, Aveir DR provides patients an alternative to traditional pacing, with beat-to-beat synchrony on an upgradable system that features long-term retrieval, setting the pace for dual-chamber leadless pacing.